I'm a man who is surviving and thriving 25 years after being given a death sentence due to AIDS infection. I'm also someone who a year ago was told that I had just a few months before my kidneys would give out and I would either be facing death or dialysis. So in that sense, I've done very well with the health issues that have been thrown at me. I'm also a survivor of childhood clergy sexual abuse. I was molested several times in 1964 and 1965 by a priest who was serving in my hometown of Douglas, Massachusetts. All of these elements come together in this story. In 1992, at the age of 40, I went public about my abuse. The priest who had assaulted me, his name is David Hawley, and at that point he was serving in Denver some 30 years after I knew him. I spent the first half of the 1990s pursuing a lawsuit which gave me access to his personnel records. And I wanted to know what was the story behind this priest. Who knew that he was a child molester? Had he ever been caught? Had he ever been reported to civil authorities? And through the lawsuit I was able to find that information. In summary, he had molested children for some 30 years in 4 states, beginning with his first assignment. And over the course of that time, 6 bishops knew that he was a child molester, had never removed him from service, and never reported him to civil authorities. But enough about that. While pursuing this lawsuit, for about 5 years in the early 90s, I was also dying of AIDS. I had several opportunistic infections, each of which could have been fatal. I had recurring bouts of AIDS-related pneumonia. In a hospitalization in 1995, in order to save my life at that point, the doctors gave me an experimental drug, which did save my life, bought me some more time, but it also scarred my kidneys. You know, I managed to hold on year after year until finally, 1996, the good drugs came along, the protease inhibitors, and I was able to benefit from them in such a way that it completely repressed the virus, and I was able to completely restore my immune system, get my health, and get my life back on track. And one of the first things that I did in 1997 was to formalize my speaking out about abuse and my reaching out to other victims. And I set up the first New England chapter of the national organization called SNAP, Survivors Network of Those Abused by Priests. So that put me in a position where I was hearing from many victims, not only from New England, but also nationwide, and I also became a media spokesperson about the issue and speaking on behalf of victims who weren't able to go public, but were trying to get their message out. I eventually decided to give up my volunteer work and try to get my life on a more uplifting path and establish, get back to my career and supporting myself. And so I resigned from my leadership position. But by then, a lot of survivors across the country knew who I was. About the year 2006, my kidneys began to have serious problems with the scarring that resulted 10 years before. And the scar tissue expanded more and more, and my kidney function dropped to lower and lower levels. And finally, I was told that I was either going to need a transplant or I was going to have to be on dialysis, which was not a good choice for me because AIDS patients typically do not do well on dialysis. You have an opening in your chest and you tend to develop a lot of infections and so on. So my doctor said, both my kidney doctor and my AIDS doctor said, you need to find a kidney donor. So in February of last year, we decided to send out the appeal to a wider net, and we sent it nationwide. And one of the people that saw the email was the woman sitting next to me, Susan Pavlak. And I will let Susan tell you the rest of the story.
And I came home and I opened my email, and although I'm not a member of SNAP, through the good graces of the SNAP director here, I'm on his list and I get the emails. And so I read the email and I thought seriously about it. And I thought, what would I do if my brothers needed this or my sisters needed this and none of us could give? And people kept sort of falling out of the testing process. So, and I'm B negative, which was the requirement for the blood type. I knew Phil had AIDS, and I have lost too many friends to AIDS in the 80s. I knew that anyone who had managed to survive AIDS since 1984 knew how to do a drug regimen. And I knew that you had to be able to take care of yourself with regard to managing a drug regimen, you know, if you're going to have a kidney transplant, because you're on anti-rejection drugs for the rest of your life. I talked to all of the wisdom people in my life, my family, and I said, what about this? And decided to go forward with the testing, knowing that at each step there was an opportunity to stop and veto it, or the medical veto would come in. Well, my testing was all done through the University of Minnesota here, and I kept checking in, and so I had these remarkably thorough tests over and over again, and
passed them all.
Surprised the heck out of me, and got to the point where it looked like I was it, kind of. So in July of last year, I flew out with my best friend accompanying me and went through a battery of tests at Beth Israel Deaconess and passed those, I guess.
Yeah, those are the final tests.
And up until...
And you met the surgeons too?
Yeah. I ate lobster.
Can I jump in for sure? One element of this is that when you need a kidney and people are being tested, unless they're people that have spoken to the recipient ahead of time, the person getting the kidney has no idea who's being tested or what the status is or where they come from. So Susan started her process in February, and it wasn't until she went all the way through the end and passed every single test that I even knew that there was another person who was a possibility. And even when she finally passed and said, yeah, I want to do this, I finally got a call from the transplant team, and they said, we have a kidney for you. But they still, wouldn't tell me who it was. They said that it was somebody from out of state. And then they said, you have to decide if you want to meet this person or not. She's willing to donate the kidney. You don't necessarily have to meet her. That's up to you. And I was thrilled and overjoyed and felt that I had, despite great odds, managed to prevail. But I was wondering now, here's a woman she's agreed to give me a kidney. Do I meet her or not? And if I meet her, what if she doesn't like me? Am I going to jinx this wonderful opportunity that's come my way? So I had a weekend to think about it and talk with my friends about it. And most of my friends, they tend to like me and think that I'm a pretty nice guy. And they kept saying, absolutely, meet her. She's going to like you. What are you, nuts? And so we arranged that when Susan came for that last test and she was through with her appointments, that I would take her out to lunch. And the surprising, what was not only surprising, but the cherry on the ice cream sundae, so to speak, is that we went out to lunch along with her friend, and the two of us hit it off immediately. We just fell right into sync in terms of our personality, in terms of our sense of humor, and it's been that way ever since. And that is probably the most remarkable part of the story, because for me, I gained a kidney, but I also gained a very close friend, and I certainly never saw that coming my way. And so we had the surgery on August 29th? 26th. Mm-hmm. See that? 26th. And
I kept the smart kidney. No, I gave away the less.
And we both remained in the hospital for several days. And then we were released.